know that guy that we just saw. He's joining us right now, Dr. Devlin, here to tell us all about the new kind of facelift. It's called a liquid facelift, and we're finding out how it works today, Doc. And I tell you, you've got so many different options here. Can you kind of break down exactly what a liquid facelift is first?
Well, liquid facelift is a non-surgical facelift, first of all. This is for patients, in their mid-30s to 50s who really say, no, I'm not really ready for a facelift. I don't want to do surgery, something like that. There's a lot of options we didn't even have 5-10 years ago. There is a number of different products that we can use depending on the area that we're wanting to treat. Most of the time that we'll see patients that utilize liquid facelift will be in their orbital region, right in through here, their deep nasolabial folds, their lips, wrinkles, and jowls in through here. A lot of times you can treat that surgically, and the surgical treatment for those obviously is going to last a little bit longer. This is more of a temporary thing. You can last maybe 2 years depending on the area, the fillers that we use.
And surgery is more expensive too.
It can be more expensive, yes. But there's a number of different teams. A lot of times we'll use fillers, and as you can see, we have a number of fillers. This filler right here, this one actually lasts anywhere from 5 to 10 years.
No
This
kidding.
is one of our newest FDA-approved ones. It's called Artifil.
Very long term.
A lot of times, but this is not, you cannot use this in all areas. So that's where the skill of the surgeon comes involved. What areas do you treat? What areas and what fillers do you put in that particular area? Radius is another one that's going to last anywhere from a year to year and a half, or maybe even 2 years. And a lot of times we'll combine that in the deeper tissues to really plump out the cheekbones. So a lot of times as we age, we lose fat primarily right in through here in our tear troughs, around our eyes. You get these deep folds in here and through here. And depending on what we're trying to treat, most of the time experienced people who do a lot of the liquid facelifts will use a combination of materials depending on what they're trying to achieve. Also involved with that too is obviously you're going to use something like the Botox, or you're going to use some of the Dysport, and that actually helps with the wrinkles that you have around your eyes, your glabella, and that type of thing. We do have some before and after pictures that we can actually show you. And you can see this lady here. If you look at the deep dark lines that she has around her face, her nasolabial folds, and you can see just kind of what you can do with just putting a lot of fillers into that cheek area, around the eyes, especially in those nasolabial folds, and you can see that you can get quite a bit of improvement. I think we have another picture too that we can show. I'm not sure if we have that one up. And same thing here. See the dark circles under the eyes, and you've got loss of volume in the cheek area. If you can go in and rebuild those cheeks, rebuild that volume that you've lost around the eyes, you can accomplish this type of result without having to have surgery.
That's incredible, especially the noticeable difference on the cheekbones, like you said, makes a huge difference.
Yeah, and most people really underestimate what rejuvenating this part of your face it does. That's the part that people really notice. People go, I look tired. Well, the reason you're looking tired is because you're starting to lose that volume as you age. Now, I will say that the liquid facelift does not really treat the neck area. And so a lot of times, if we do have to address the neck, we'll do like a little mini facelift or a mini neck lift, and we'll adjunct that with doing a liquid facelift on top of it, and that way you can kind of get the best of both worlds.
Excellent, excellent. So many different options that you guys offer out there, and I know 25% off I just saw on the ad?
On our surgical procedures right now, yes.
Excellent. How long is that going to?
That is till the end of the month.
End of the month, okay.
Yes.
Get to the end of the month to call the number on your screen. Once again, Devlin Cosmetic Surgery, and there's also a website on there for you too. Go to drdevlin.com for more information. We appreciate you, Doc, coming in, explaining this. Very popular procedure we know that's becoming increasingly popular, answering some questions for us this morning. Thank you.
Thank you. Okay.